Okay, so I've already washed my hands. I've performed hand hygiene, and I'm going to be your nurse today and taking care of you. What is your name?
Joshua. Wow.
And I'm just going to make sure that this matches up with my records or his wristband, and it does. And at this point, I would note his general appearance, and I already have his vital signs. So now I'm going to start on the head, and I'll be looking at the hair. I'm going to be looking for the quality of it, the distribution, the texture of his hair, just inspecting that. And I'm just going to be looking at it from several different angles, looking for any abnormalities. And I'll be noticing his scalp for any lesions, and I'll be noticing his skull, the contour of it, the asymmetry of it, his face, his expressions and his contours, and the skin for any lesions or discolorations. So I'm just going to do that right. I'm going to be touching you. Is that okay? So I'm just filling his skull and checking everything and parting the hair, making sure there's no nits, that it's clean, and I don't feel any abnormalities. I also palpated, and I didn't feel any lumps or anything as I was palpating his skull. So now I'm going to be moving on to the TMJ portion. I'm going to be inspecting his TMJ for any swelling or any redness, and then I'm going to palpate it and make sure that it all checks out. Can you clench your teeth for me like this? And then open your mouth and clench your teeth again. And then right here, I'm going to be inspecting his temporal arteries. And then I'm going to check them for any bruise. And all that checks out okay. Also, while I'm here, I'm going to be palpating his sinuses for any tenderness or swelling. Do you have any tenderness whenever I'm palpating? No tenderness here? And now I'm going to be inspecting his neck. I'm going to be looking at his neck for any scars or masses. And then I'll be palpating it and lymph nodes and his thyroid gland. You can just reach like this. And then I need to get behind you. Do you mind just stand up for me? Just stand like that. Now I'm just going to be palpating his trachea and his thyroid gland, and I'm going to have him swallow. Okay. You can have a seat, please. And now I'm just going to be palpating his lymph nodes and seeing if there's any swelling in his lymph nodes. So I'm going to start at the pre-articular and see if I feel any nodes. They should be non-movable. No, they should be a little bit movable. And the pre-articular, and then the tonsillar, the submandibular, the submental, the anterior cervical, the posterior cervical. And could you move your head this way, please? and the deep cervical. And then I would, you can face me, and then I would feel for his supraclavicular. Actually, this would be the infraclavicular, and then this would be the supraclavicular, because this would be, no, I was correct the first time. Subclavicular here, which is above the clavicle, and then infraclavicular, which is below the clavicle. Okay, next. That's the first part of our neck inspection. Your palpation. So I did the thyroid, and we made sure that he had no tenderness. Here it says to check the thyroid gland to see if it's enlarged or check for any bruise in the thyroid gland. So I'll go ahead and auscultate his thyroid gland. No bruise. Now we'll move on to the eye examination. So here we're going to start with the visual acuity. And do you use any eyeglasses or contact lenses?
No.
And we'll just have him read from the Snellen chart that I have here. And we'll have this 6 feet away, and I'll have him read can you read the bottom line for me? This bottom line right here.
LTFPH.
Can you cover your right eye? Can you read it again?
LTFPH.
And cover the other eye?
LTFPH.
Thank you. Okay, and then I'm going to do a visual screening test, and I'm just going to have the patient to okay. Can you cover your right eye? Whenever I'm going to have my hand come into your visual, you tell me whenever you can see my finger. I'm going to start from your ear.
No.
Okay, do the other eye.
No.
Okay, thank you. And now we're going to inspect his eyes and his lashes for any discoloration masses. And we'll be checking his pupils and for the size and shape and symmetry of those as well. His eyes don't look injective. And now I'm just going to see if his pupils are round and reactive to light. So that one was reactive. Now I'm going to watch for the opposite eye to make sure that it responds to light in the opposite eye. And it does. I'm going to do the same thing to the other eye. Now I'm going to watch for the opposite eye to make sure it constricts. and it does. And now I'm going to do the 6 cardinal fields of gaze. I'm going to have you just watch this pen light at the top here. Just follow it wherever it goes. So I'm going up, down, side to side. This way. Okay, and now I'm going to, it should be a darkened room, but I'm going to check to make sure the fundoscopic exam and make sure I can see a red reflex. I'm just going to put this in her eye and I'm looking for it. Okay, I'm going to look in the other eye. My light isn't too bright. I could see a little bit of a red reflex, but I couldn't necessarily, I wasn't able to assess the blood vessels. I wasn't able to get that in depth. But I would, if I was able to, I'd be looking at the macula and the fova. And so I was inspecting the optic disc. I was inspecting it. I would be inspecting it for color and clarity. So now we're going to move on to the I need to do the nose, the ears, nose, and throat. So for this, I would be examining, I would start with the ears, and I would start by inspecting the auricles for any deformities, masses, or lesions. So I'm going to just pull on your ears a little bit. Does this hurt?
No.
So I did the tug test. And now we're going to inspect cranial nerve 8. So I'm going to have you put your finger in that ear. I'm going to whisper something, and you tell me what I say.
Baseball.
Include the other ear. Do the same thing.
Apple.
Right. So that tested the cranial nerve 8. And now I'm going to inspect his ears. And I'm going to pull upward on the auricle and look down into his ears, and I'm going to inspect the tympanic membrane. Does that hurt? So I see the pearly white, and I do see some, a little bit of, not necessarily drainage, but I see some yellow in there. Maybe a little bit of redness. I didn't see any foreign bodies, but I did see some erythema in there. And now I'm going to do the conductive versus the hearing loss. I'll be performing the Weber and the Ron test. So first I'm going to place the tuning fork. I'm going to place it in on the bridge of his head and see how he does, if he can hear it. Which ear do you hear this best out of?
Right.
Normally it should be equal. Okay. Now I'm going to do the same thing, but I'm going to do this. This is the Ron test, and this is going to go over the mastoid. So I'm going to do this again, and you're going to tell me, I'm going to place it behind your ear, you're going to tell me when you can no longer hear it vibrating.
Yes. No, okay.
Can you hear it now? Yeah, let me do it out of this end. Can you hear it?
Yes.
Let me know whenever you can't hear it anymore.
And no longer here.
Can you hear it now?
No.
Let's do that one more time.
Can't hear it.
Can you hear it now?
No.
We're going to move on. And now I'm going to be inspecting his nose, and I'm going to check it for any lesions. I'm going to be looking for symmetry, and I'm going to be palpating for any masses or tenderness. Does this hurt? Can you look up for me? Okay, I was looking for any turbinates and any deviation, and there was slight deviation in the septum. I didn't notice any swelling or bleeding. And now I'm going to be looking at his lips, and I'm going to be looking at those for any lesions or cracks. I'm going to have him if you could open your mouth for me. Okay. Stick out your tongue, please. Open wide. Okay, so here I'm going to be looking for his tonsils. They are really big.
Hmm.
And I'm looking at the uvula, and I'm looking at his tongue. I'm looking at his teeth for any cavities. I'm looking at the soft palate, the hard palate, having lift up his tongue, looking under there. And then if I had gloves, I would be inspecting and palpating the tongue. I would do that for any induration that I felt, and see if there was any masses or anything on the sides of the tongue. And then I was also inspecting his gums and his teeth, and for any loose teeth if I had gloves to palpate those.